Hi, this is David Quimby from Infectious Diseases at CHI Health Creighton, and I've been asked to talk a little bit about face masks and vaccines. Since it's about face masks, I figured I would actually wear one at the beginning before I take it off before the main part of the video. So here we go. All right. Questions have come up with, all right, I've been vaccinated. Why do I still have to wear a mask? Because I'm not going to be getting sick. And we have found that vaccines do prevent people from becoming severely ill or in the hospital or dying, and that is all kinds of good. There is some stuff we don't know, however. We don't know the rate of asymptomatic infections that you can have if you've had a vaccine. That's being studied right now, but we really don't know it yet. The problem there is even if you're protected from being severely ill, how about the people around you? A mask does help protect you a little bit, but it also does a really good job at protecting other people. For example, say I'm wearing my mask here, and I start coughing a lot. Because I have a mask on, I'm not spewing forth my little cough particles into the air as much for other people to breathe in. So if I am sick, I'm not going to be as likely to infect other people. So if I've been vaccinated and I have a very mild illness or asymptomatic infection, it means the vaccine's doing its job, but it might still be possible for me to transmit things. So that's why the CDC's come out with some new guidance about what you should be doing mask-wise if you have had your vaccine. First off is if you're out in public, you're probably around a bunch of people who have not been vaccinated yet. So when you're in other crowded areas, around a bunch of other people, in buildings, going grocery shopping, whatever, you should still be wearing your mask because you're around a bunch of people. If you're visiting just in your own home and you've been vaccinated and the people who are visiting you have been vaccinated, you can go probably without your mask, because even if one of you were to have an asymptomatic infection, the other person is not likely to become severely ill if you did manage to pass it along to them. And then you run into the different scenarios of, well, one person's vaccinated and the other's not, and the person who isn't vaccinated has certain health conditions, whatever. It basically just boils down to risk issues. And when you see that, all right, I'm protected from being sick, but I'm going to be around somebody who would be a very high-risk person if they were to become ill, I should still be wearing a mask even though I'm vaccinated, because they're not. Whereas if I'm vaccinated and I'm around somebody who is young and healthy and they haven't been vaccinated, it might be possible to go without a mask there in a small private setting. You have to keep in mind, though, that these guidelines are pretty specific. They are only for small private settings and not involved with hospitals or clinics or necessarily group living environments, those type of places. So basically, there are loosenings of I don't want to use the word restrictions because it was not really enforced in private settings or anything like that, but the recommendations on mask wearing for the vaccinated people, and as more and more people in the community get vaccinated, it'll probably loosen out some more. Really, if you have any questions about what should be done mask wearing wise or whatever, it's on the CDC website. I believe it's on the state of Nebraska Department of Health and Human Services website, and you can also speak to your local provider for questions. All right, thanks very much, and everybody keep doing your bit, and we'll put this thing in our rearview mirror. Thanks, bye.